The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Dr. Tom Roselle. You're listening to Ageless Health with yours truly. And we have another interesting episode that we're going to get into, one that probably affects way, way, way too many people. And when you hear the term, you say, oh my God, what am I going to do? It's a problematic situation. What we're talking about is spinal degenerative stenosis. And that's when the hole where the nerve comes out that goes to different parts, your legs and so forth, begins to be compromised, means narrowed down and so forth. And as we get into the program, I'm going to really get into detail the things that cause it, going from a misaligned vertebrae, which we call a spinal subluxation, just millimetric misalignment, so now it can't move, to this constant, slowly, sometimes not so slowly, degenerative change. But let me show you what a healthy low back vertebrae looks like, okay? So this is very typical of what the low back vertebrae look like, right? Here's a bone on top, bone on the bottom. There's a disc space in between. That's your shock absorber. Now, if we went like this and we went cross section and we flipped it over, there's your spinal cord. Here's your nerve roots. Now, the nerve roots do something very interesting, is that they divide. You see the break? So it comes out of the canal in between the two vertebrae, a nice big hole if it's healthy, and it divides. One branch goes to muscle, the other branch goes to organ system. So as long as this hole is well maintained, then you have freedom of communication from a structural component, and the signaling should go where it's supposed to go. Now, what happens sometimes is that the gliding points, this is what you would see if you were looking directly at your back. These are the bumps you'd feel if you ran your fingers down the middle of your back or somebody else's back. So they need to be aligned symmetrically. And these gliding points, these things I'm pulling apart here, they're called facets. Now, they have to be able to move back and forth easily without restriction. But sometimes because of injury, because of stress patterns, because of biochemical irritation, they lock, so they don't move the way they're supposed to move. So what happens over time is that you start getting degenerative changes in the shock absorber called the intervertebral disc. Now, if that happens, what takes place is you get a narrowing of this canal. So spinal stenosis is a narrowing of the canal where the nerve comes out. And I'm going to show you what that looks like, and then we're going to go back to it again. So first it'll start with that misalignment. Then what you see is you start seeing the disc space begin to shrink, and that canal gets a little tighter, gets a little narrower. And if it's not corrected, and it can be corrected very easily manually, it can be corrected, with some spinal decompression. It can be corrected by supportive means as well. But chemistry and mechanics go hand in hand in this, meaning if you're eating things that you shouldn't be eating, this moves very rapidly. And because of the high levels of inflammation, remember what I've said over time, inflammation means acid, and it'll start breaking it down. But ultimately, what it begins to look like is this. You see how that disc has crushed? You see the little beak in front? Okay, that's an osteophyte. And the hole, as you see, is no longer nice and wide. That compression, that irritation is spinal stenosis. And it can happen because of this. You can get calcium in there. You can get scar tissue in there. It can be very ugly. That scarring begins to allow restriction. And then the calcification ultimately gets in there. The degenerative changes get there. It gets hard. It gets brittle. Now, I'm going to give you a very common reason that this happens progressively faster than it should after an injury. It's called dehydration. Most of you think water's for washing and you don't drink a lot of it just to keep your body nice and loose in movement. You need a lot of water. When I talk about a lot of water, you've heard me say it before. You take your body weight, divide it in half, and that's the number of ounces that you need to shoot for every day relative to that. Because what happens is that little bit of water that you get in goes into lymphatic tissue, if you're lucky, and begins to flush stuff out. What's residual goes to the disc spaces. And these disc spaces, these intervertebral disc spaces, are made up of 75% water. So if you're dehydrated, they shrink much more rapidly. So here's a healthy vertebrae, healthy disc. Okay, nice big hole. Disc space is well maintained. The shock absorber is what it's supposed to be, nice and thick and so forth. So it cushions you every time you move and allows you to move back and forth. But then, because of injury, because of biochemical irritation, because of stress patterns, it moves over time to the place where it begins to look like this. And then your doctor says, we have to go and infuse your back. Your doctor says, we're going to do steroid injections. Your doctor says that, unfortunately, you're going to have to live with this the rest of your life. Your doctor says there's complications to surgeries or injections and so forth. Now you're hooked on opioids and steroids and so forth. Well, I'm going to suggest to you that that's not the case. A couple of weeks from now, actually about, I think it's 2 or 3 weeks, losing track of time, Dr. Harlan Browning and I will be presenting a class on Oh My Aching Back. And we're going to be looking at spinal stenosis as well as other things as well. We're going to show you how to begin to put this together. Now, when I say put it together, I mean put the pieces of the puzzle together. So one, you can prevent this from ever happening. Number two, and this is the most important part, can you reverse it? So on July 16th, 6 p.m. at the Roselle Center in Fairfax, we welcome you to find out how maybe once and for all you can get rid of that back pain that you've been suffering with for so many years, and it's restricted you. It doesn't allow you to do anything. You got that fragile back. You can't go out and go for a hike. You can't lift your grandkids or your children. You're in trouble. It's like life is not worth living anymore. Well, guess what? Maybe we're going to give it back to you. So 16th, join us. All you have to do is call 703-698-7117 and register for the class. You can go online, go to rosellecare.com, or you can go to drtomroselle.com and register there. And the only thing, the only thing that we ask of you is really simply this: if you can't make it, just let us know. A day before, 2 days before. Why? Because we usually have a waiting list, and we want to be able to call people and say, hey, listen, there's going to be space, so we'd like you to join us. So, but please join us. I promise you this will be one of the most life-supporting classes that you will ever attend. Dr. Browning, the professor, as we lovingly call him, he's brilliant. And between the two of us, we're going to go back and forth, and we're going to give you succinct processes and expectations of what you can do to reverse things. And a lot of you are going to say, well, this is permanent. There's nothing I can do about it. Well, I'm here to say to you in a personal way that things are not personal and permanent. See, because all of us have problems. All of us have traumas. All of us have things that we've slipped on over a period of time. And then we say, well, it must be my age, or it must be whatever it is. You fill in the gap. When you identify the cause, the underlying problem, as long as you're breathing and as long as your body is replicating cells, you can reverse the process. Now, depends on how much time you got left on the planet, but you still can make life a whole lot better. So join us on the 16th, and we'll show you how to put this together. Let's get into the program, because I really want you to understand this. I want you to understand that this silliness, this craziness that goes into multiple stages can be minimally modified. And in many cases, in the greatest amount of cases, if you do it the right way, it can be significantly reversed. So wouldn't that be cool? If you can, if you took a before and after imaging of your spine, an x-ray of your spine, and you said, oh my God, how did it go from this? Now it's getting a little fatter, and the hole is much bigger, not being compressed and strangulated. And all of a sudden that leg pain goes away. Let me tell you something about spinal stenosis. on things that we don't think about. Guys, this is a message for you. So heads up and listen to what I'm saying. Sometimes we end up with erectile dysfunction because the nerve that goes, to that area is being crushed. And it's often crushed because of low back problems. Now, if you could reverse that and know that every time that you move, your friend doesn't go away, wouldn't that be great? Now, I'm telling you from hundreds and hundreds of patients who have suffered like that over the years that it's very possible. So join us. Ladies, the same thing. If you have vaginal pain on penetration, vaginal pain that just kind of hits you like a knife and gets your attention like that and just goes away, that's low back. And that could very much be a spinal stenotic pattern. So you don't have to tell us when you get there, guys. You don't have to tell us, ladies, that that's the problem. But I'm going to promise you, if you pay attention, you're going to understand why that takes place, because all of those nerves that come from the low back, from the fourth and fifth and the last disc space, the fifth one as well, if that gets irritated, those nerves get compressed. And if they get compressed, you got a problem. And so we're going to show you why that takes place. And we're going to show you that there is a possibility of resolving it and turning it around perhaps permanently for the first time ever. So we want to make this happen for you. We want to make sure that you understand that there is a resolution to this craziness and that you don't have to suffer with it forever and forever. So let's talk a little bit about what this is all about, okay? So in spinal stenosis, by definition, it's characterized by a narrowing canal that I just showed you, right? In a healthy segment, this is what it looks like. This is the canal we're talking about, this one right here. And it can put pressure on the spinal nerve root, but also it can put pressure on the spinal cord. You see how intimately they're related, right? Here's the nerve, here's the spinal cord. And if this misaligns and it begins to look like this, right? This one, where that canal is crushed, it's also putting pressure on that cord. If we cut it away like this and we look, it's got to put pressure on it. So when you know that exists, and you end up with the pain, the tingling, the numbness, the muscle weakness, the inability to do anything. You look at your legs, and no matter what you do, they're just not firing the way they're supposed to. You can't lift your toes up the way you want to. You can't get up on your toes the way you want to. That's an indication that fourth or fifth disc space in your low back is not doing what it's supposed to do. So you go to the doc, right? And we know that it's caused by degenerative changes and is associated with, if you go to the literature, here's the other thing. Here's the fight that I have with them. It's associated with aging, and they call it arthritis and so forth. Well, aging isn't the reason why these things happen. Time happens over a period of time. But there are people, why are there some people who are in their 80s that have beautifully spaced discs in their low back or in their neck? Why is that? If it was age, then all of us would have it at one level or another. I'm here to tell you that that's not the case. And there's a lot of folks that have really beautiful spines. But unfortunately, in today's society, there's so many of us because we eat horribly. So now we have high inflammatory reactions. Remember, inflammation means acid, right? And we start putting, that uneducated belly that we have, that softness that we have. And now the spine begins to take a lot of pressure on it that doesn't need to be there. Now, if we have ligaments that get too irritated, meaning they get torn, they get thickened, they put scar tissue because they've been overworked, do you think that's not going to have an impact? Do you think that is going to allow free movement, free function of those intervertebral disc spaces, that it's going to allow this beautiful setup here to be able to move mechanically the way it's supposed to? Like, it's supposed to bend one way, bend the other, go forward, go backwards, rotate, and so forth. That's the way that's designed to be. But if because we're not exercised, because we have a diet that's terrible, because our stress levels are through the ceiling, this acid, which we call inflammation, gets so high that it begins to destroy and degenerate and break down that system. Now, spinal stenosis is a condition that is characterized by narrowing of this canal. All right, that's all it says. That's all it means. Then you have degenerative spinal stenosis. What does that mean? That means that you start getting breakdown, degeneration, loss of bone structure, infiltration and calcification, infiltration of scar tissue within this area, that this shrinks and so forth. So when we know that happens, and we know that it begins to lead to other types of deformity and impairment, we ought to pay attention, right? So what can you do on your own for spinal stenosis? Well, if it's in the initial stages, put some moist heat on it. Don't put ice on it. Ice is used when there's an acute inflammation. You went outside in the garden and you've been pulling and straining and so forth. Then you take a bag of ice, you put it on the joint space, and you do it for about 20 minutes and get it off there. Usually contrast will help. Ice, heat, like that. Now, heat is usually a better choice for arthritic degeneration, but you have to make sure that it's a chronic pattern. Heat increases blood flow. It increases the movement of fluid within the area. Now, what else can you do? Well, if you have a chair like I'm sitting on right now, and if you push up on the chair with your arms and you just let your bottom just kind of hang there a little bit, and then you gently bring it back down, that will help open and decompress this space. So all you're doing is you're stretching a little bit and you're bringing it down. You're stretching a little bit and you're bringing it down. That acts in two things. One, immediately decompresses, but also it increases the blood supply and circulation, to the area. Spinal stenosis is something that is very debilitating if you let it continue to advance. And it gets to the place where the vertebrae are fused. But we can also get to a place with spinal stenosis in the initial phases where you begin to see a bulging of the disc itself. Why? Because the covering is called the annulus, and if you want to know the full term, it's called annulus fibrosis, begins to break and tear, and pretty soon the pressure begins to move through this hard outside cartilaginous substance, and this is soft like toothpaste, and it begins to push through. So you can go from a spinal stenotic pattern in the initial stages to a combination where there's herniation as well. I don't know about you, but I think I'd like to avoid it as much as possible. We're going to show you how to do that on the 16th, so really join us. But spinal stenotic patterns are something that you don't ignore and say, well, I'm going to end up having surgery at some point. They're going to end up fusing my back. They'll start out with some steroid injections. They're going to do 3 of them. And then when that fails, they're either going to put me on oxycodone and gabapentin on a regular basis because I can't handle the pain. And then when that fails, they're going to go in. And then you know what they might do? If you're still complaining about it, they put a simulator in your back. They put this wire in, and you have a little button you press all the time. And what it does is it sends a little shock to the system that your brain registers before the back pain. Is that how you want to live? Join us on the 16th. I'm going to show you why that you don't have to do that and how you can turn things around. Remember all the nerves that come from your low back that emanate from that part of the body go into your legs, go into your feet, go into your buttocks, go into the organs of reproduction. They go into the intestinal tract. And if those areas are irritated, you're going to have all kinds of symptoms, even constipation. You can go the reverse. You can have some diarrhea. You can have abdominal cramping. You can have vaginal pain. You can have scrotal discomfort and so forth. I mean, it gets to the point where, people start chasing their tail and they're spending hundreds and hundreds of thousands of dollars, and as a society, hundreds of millions of dollars to try to fix this when it is fixable if you're willing to do what it takes to get done. We're going to lay that out for you. We're going to show you what can be done. We're going to give you things you can do at home to help yourself. This is an important presentation because it is awful and it affects way too many people. So join us on that night, on the 16th. And I promise you, you're going to go home with more information that you thought was possible on this type of situation. It is resolvable. It's not something that you have to necessarily live with. So what happens in this situation? How about the diet for spinal stenosis? What do you want to do with it? Well, first of all, get rid of the sugars. You've heard me say that repetitively, right? But even if we went to my mantra, eliminate sugars and sodas and coffee and black teas and fast foods and fried foods and alcohol and gluten and additives and GMO products and so forth. But we want an anti-inflammatory diet. We want foods rich in omega-3 fatty acids, fatty fish, if you will, walnuts, flax seeds, things of that nature. We want a lot of green stuff. Kids don't like green anymore because we don't make them eat green anymore. Some of us don't want to eat green anymore. I eat a lot of green. So, but leafy green vegetables and, spinach and the kale, the things that are highly rich in mineralization, calcium, and so forth. Believe it or not, one of the things that you can do on a regular basis, if you get some Celtic salt or Himalayan pink salt and take about a quarter of a teaspoon a day and put it in your water, you'll find that by itself will begin to modify some of the changes. Why? Because it's high in mineralization. You want to get lean proteins. Did you know red meat's one of the worst things that you could do if you have spinal stenosis? It's not okay. It increases the ability to gout. Shellfish is not okay if you have spinal stenosis. But things like chicken and turkey and different beans and so forth, eggs, those things are really healthy. You want to get those lean proteins in. Healthy fats. What am I talking about? Well, olive oil, number one. That's your go-to choice. Avocados, things of that ilk will help a lot. Even flaxseed oils. You want to. The different authors will tell you to bring it down, but I'm telling you to eliminate, get rid of the sugars in your body, and you can have a little bit of. You can have some berries. Fresh strawberries and blueberries and raspberries and things like that. Those things are good for you. Make sure they're organic because you don't want the other junk on it. But these dietary modifications, just the ones I've told you, and stay away from the heavy grains, the modified grains, because most of us in this country are going to be sensitive to glutens and grains. Why? Because most of them are modified. They're GMO. They're not the old ancient grains. They're not the things that I grew up with and people outside of this country have grown up with. So there's things that you can do to make a difference. This rage about doing chair exercises. You go on the computer and said, what's your age, do this. Chair exercises are really good if you haven't done anything in a long time. So start stretching in the chair. You start doing some rotational movements. Not hard. You don't have to grab the back of the chair and pull it, but nice and easy motions all the way through. Same thing with your upper part of your body. Do some bending like this. Do some extension like this to the best that you can. Stand up and sit down in the chair, even if you have to use your hands to push you. Stand up and sit down. Very simple things. I didn't give you a whole lot to do. I gave you a couple little things to get done. It's important that you take charge and you do things that you can do to modify, to help, to make a difference so you can live. And you don't want to sit there and say, this is life. This is what old age is about. That's where the old, expressions come, old age is only for the brave, right? Well, I don't know about you, but we're all going to get there. And I hope that, my creator gives me another, 3 decades or more. And I'm going to try to figure out how to get there. And because I got a lot of stuff to teach you yet, and it's going to take that long for me to make it happen. But you got to watch your weight too. How many of you are sitting there and you know that you're like 20 pounds overweight or more? Even 15 pounds overweight. What are you doing about it? You're just hanging? You're going to let that say, well, there's nothing I can do about it. It's my age. It's my hormones. Or are you going to really try to hold yourself responsible to make it happen? How many of you love that can of beer all the time, right? Well, if you do, you're getting a lot of carbohydrate. If you do, you're getting a lot of inflammatory things into your body on an ongoing basis. You're getting things that will cause degeneration. That's right. Unfortunately, beer and alcohol of any kind, I just kind of picked that out. Some of you can handle a little bit of red wine, but it has to be outside of this country. Why, you ask me? Why am I putting down U.S. wines? Not all of them 100%, but the majority of them have high levels of stenosis, and they still use Roundup in the fields and around them and so forth, and they're exposed to that. So if you're going to have something like that, I would suggest that maybe you look outside the country and you do your research, and you don't want to put that stuff in your body because it causes high levels of inflammatory reactions that your body's not doing what it's supposed to be doing. But if you're going to heal spinal stenosis and try to get it to where it's supporting you again, you have to eat well. You have to do exercise. You have to get treated. You got to go see somebody like me, and that really understands the process, and begin to open that low back up. But you have to add all the other things. So you got to do stretching. Little things I showed you about how to do spinal decompression, just lifting up in the chair. There's a lot of things that you can do, and we're going to show you how to do that on the 16th. We're going to show you what to do. We're going to send you home with some homework, and we're going to give you some options relative to what can take place. Please understand, this is not something that you have to live with. It's not something that you have to tolerate or put up with. You can reverse this. Please join Dr. Harlan Browning and I on July 16th, 6 p.m. at the Roselle Center for Healing. Schedule it today. Make it happen. We'll see you then. I promise you it will be very well worth your attendance, particularly if you've begun to modify your life and you can't do the things that you like to do, want to do, would be excited to live with and have fun doing over the years. Listen, everybody, I keep putting things out there so you can have a better life, so you can live agelessly. Remember, that's really your gift. Ageless health is really what you are able to do, that you deserve to have. And I'm here every Sunday, every week, for one reason only. I love you all. You have a great day. See you soon.
you.